Hey, it's Dr. Jeff Pierce from Michigan Sports and Spine. You know, the sun's out, everything's good. I'm a year older. I have good news for everybody who was really concerned. I'm not sure anybody really was, but my labs came back that I took last week. And you know, I like to say I like to practice what I preach. All my labs were good. I will admit my cholesterol wasn't perfect, and I need to work on that, which is my goal for this year. My goal is to work out more. My goal is to watch my nutrition, listen to Lisa McDowell, and actually start doing some of the things she suggested to me because I highly respect her. And that's the purpose of today, is to really find someone that you are buying into. I'm getting so many things. The more we talk, the more people we meet, the more issues we have, the more things we're doing on social media, we're starting to find out that people are not maybe getting the best information. They're not seeing the best doctors for them. I'm starting to push, the simple concept is you need to go to someone with the right tools to get to the right answer. And sometimes there's an answer that might be misleading, that it doesn't add up. So some of the questions today address that, and I'll get more into it. But overall, we're hearing about getting more outside. My daughter just sent me an old song from 2014, and this woman that we met from London. So it's just, I think the sunshine's going. I think we're in the state of Michigan. We're hearing now Florida's open and Texas is open. Right now the sun's out. That allows us to go outside. We're not on restrictions. We don't know if we need to count the 50% at the restaurants and all that. So let's make the best of it. But the thing is, let's be better going out there, today, tomorrow, and everything else. So how are we going to do that? We need to do self-evaluations. If there are issues, we need to make sure you're going to the right doctor. So I was getting into kind of what my message is for 2021 and some of the things I have coming up, and what I'm working on is kind of the same kind of theory why I started doing the radio show, is to educate you so you're making the right choice. Are you seeing the right doctor? Are you going to the right person? Are you putting off something that can be something deadly or more serious that can be preventable? It's really 2021 is about prevention, about health and prevention. With COVID, that we need to be better human beings and healthier human beings. So, is it wellness? Is it metabolic health? We can talk about all that, but really what incorporates and what sticks with you is the most important. So last week, again, we're pushing real hard about the PRP and stem cell and the biologics and that, because I feel after doing it for this many years that it's so important to get out there. That I think it's major benefit. I think a lot of people are going to benefit from it. We're talking about metabolic health. We're talking about prevention. And really the sad thing is a lot of the research is starting to push that the illnesses are coming almost a decade early because of the type of food we eat, because of the lifestyle we're living. The issues that we had, even with diabetes. Diabetes wouldn't show up to your 40s and 50s. You're not seeing it in the 20s, 30s. And diabetes, just, I'm not going to harp on it, but it affects every part of your body, every organ in your body, and you don't get to see it. So my great example is the car, right? We have these new cars that are great, and you hook them up to an electronic thing and it tells you what's wrong. Well, it's the same thing. It's like we drive the car, but we never really look under the hood, and that's the way you need to treat your body. The more you're damaging and running the body, the higher you're running it, the higher RPMs it is, the more wear and tear you're going to have on the engine. Same thing with your body. If you're not treating it efficiently, if you're not putting the right oils in, the right gas in, changing the tires, rotating the tires, you're going to prematurely wear that car out, and we don't look under the hood. Not many of us look under the hood anymore. Well, think of the internal organs in your body as being under the hood. We get to see your physique. We get to see the guys that work their biceps and their chest and things like that. But we need to evaluate what's going on. How's the guts of the car working? Same thing with the guts of the body. So that is really the biggest message I can send you from a prevention standpoint. We need to start understanding what's under the hood. So getting the question one, when is it best to get a steroid injection for your low back? I've done physical therapy series a few times, but a new therapist is recommending injections. What's the ideal timeline for this? So the ideal timeline is to be very aggressive. If you come to Michigan Sports and Spine, we work under the philosophy of sports medicine, but we treat everybody like that. So it's always the philosophy, we want you better by Sunday. We gotta get you playing by Sunday. That's been the mentality since I started, and I think it works well for us. It's not like, oh, see us in 4 weeks. It's see us now and let's get going right now. Because the more aggressive you are, if you've already failed therapy, the problem is we want to do that injection because you don't want your physical therapist spending time getting you out of pain. Do things to get yourself out of pain, whether it's a medication, whether it's stretching at home, whether it's stimulators at home, or an injection. A lot of educated therapists, especially the ones that know my protocol, know that you need to get out of pain, because if you have only, right now we're so restricted by insurances, you have 20 visits. Okay, if you spend 15 of those and the therapist is just climbing uphill getting you out of pain each time because you can't get to step 2, like we have, if you've heard me before, we have a 4-step program. So the first step is get you out of pain. So whatever we need to do from an aggressive timeline is get you out of pain so you get the benefits of the body, self-healing, therapist helping, instead of you're going to a therapist, you're spending 60 minutes with the therapist just for her to reduce the pain. You're battling uphill. You're not doing it right. You need to be aggressive. So when I say you need an injection, the injections will bring the pain level down. So when the pain level comes down, that allows the therapist to get more done on the next visit. She can work on your flexibility, your strength, your conditioning, your proper body mechanics that have been altered because of the discomfort. You need to have that quicker. So to answer your question in a simplistic way, it's sooner, if you have the red flags for it, if you have the indicators for it, if you're not responding in 2 weeks to traditional medication, stretching at home and therapy, you're now a candidate for injections. Is it aggressive? Do people not like it? It's a very small invasive procedure. People are always worried about the size of the needle. The size of the needle isn't what goes in, it's how deep we have to go to get there. And we use a little bit bigger than an acupuncture needle, and we numb it up. Here, we're much more sensitive because I'm a sensitive guy. But we're sensitive to your needs. We're not sitting there and putting you through pain. We put you in a very controlled environment. We have a little anesthesia to put you what we call in la-la land to calm you down, if you're that type of person. It's all about the comfort of you. It's all about patient care. We want you to have a good experience. We're not here to just, like some people tell you a story. This doctor just shoved the needle in and he didn't care. He wasn't caring about where it was. It hurt like H-E double hockey sticks. And you just need to go to the people you trust. We have a long track record. We have a great new staff with Dr. Bonnet here, and we're able to do it. We're able to do it in a very pain-free type of environment. But again, the simple answer is sooner the better. If you're showing red flags that you need to get in quickly. And we'll be happy to talk to you any further or see someone like me. Question 2, what are your thoughts on stem cell obtained from other people? Some say it's best to use someone else's if you're older because their cells are younger. So this is a very simple question that's with a very long answer. The number one thing is if you're a healthy individual, they say 50 and below, you're absolutely using your own. As you get into the 50, 60 decade, depends on how good your metabolism, your metabolic life, how healthy your cells are. Number one thing is it's always, like I say, it's the whole food of medicines. It's always better to take from yourself. So our goal is always to take from you first. Are there better, what I call third-party products that are out there? Don't think of it as you're taking cells from someone else. This is being harvested in different ways, so you need to know which, we'll just keep it simple, a third-party biologic will do for you. So it's not like, hey, I'm taking it from Joe's son, who's 22 years old, and he's a healthy young athlete. We're not taking his cells and putting them into you. These are cells that have been taken in certain different ways, all FDA approved, and which we're doing now. And it's called a biologic. They're not really called stem cells. We're getting away from the word stem cell because it's a little bit misleading. They're biologics, which have those healing properties, especially what we call connective tissue. So when we're talking about musculoskeletal medicine, what we do majority of the time is that we're taking for healing and connective tissue. But the number one answer is, depending, unless you're like 80 and not doing very well, you may not be a candidate as is. I usually will try to use your own stem cell. Some of the new biologics, they're working. The studies are showing a good promise. So we're actually looking into start doing that for those that are going to have difficulty with what we call self-harvesting, taking from yourself and spinning down the stem cells from there, from your bone marrow. So hopefully that answers that question. But again, you're welcome to come in, especially this month. We're doing free assessments to see if you are a candidate for stem cell and PRP, and we're willing to explain that to you and educate you on that. So, that's something we're doing because I just feel so important that people are being misled what's going on. They're getting not necessarily the best information out there. More people are doing it, but it's still only a handful of us are doing it correctly. So be careful who you kind of hook up with that. Number 3, my family doctor said the change in my bowel and bladder habits could be caused by a pinched nerve in my spine. How could this be? So that's a very involved question. So you have the spinal cord. The spinal cord on my buddy back here, I don't know if you can see it, but this is from the back of your head all the way to your tailbone. All these nerves here have some type of innervation to other parts of your body. So down in the lower thoracic, upper lumbar, you're actually working with the bowel system, bowel and bladder. You can be in so much discomfort that it's causing the discomfort. It could be medication that's causing you constipation, which is altering your bowel and bladder. Could you have an impingement, a pinching of the nerves in that section of the spine that controls the bowel and bladder? It's possible. We really need to rule that out, but usually it's not the case 100% of the time. It can affect it, but it's not going to stop it. If you have issues of incontinence, meaning you can't control your bowel and bladder, that's considered an emergency red flag that you need to see a physician or actually go to the emergency room if that does happen to you. So again, bowel and bladders are affected by nerves in your spine. That's if you're getting constipated, which medications, especially with narcotics, are notorious for kind of binding you up, causing that constipation. So there's other medications that we give to alleviate that. The nerve itself, if it's pinched, this whole spine does direct areas of your bowel and bladder. Everything branches off from this big spinal cord that comes from your brain to control your whole body, including your bowel and bladder. And if it becomes that you're incontinent, meaning you can't control your bowel or bladder, then that's a big emergency that you need to go to the emergency room and see a physician right away, because those sometimes are surgical. So, question 4. I heard you say that ideally both PRP and stem cell is best. Which one should you do if you can only do one? Is it worth it to do stem cell or multiple PRPs? So I don't know if this is driven by a cost factor, if it's driven by what's going on. Yes, the ideal thing is, I'll give the example again. Again, we're talking about biologics, including stem cell, including PRP. So if we use the simple analogy of your grass, beginning of the year, which is coming up here in spring, you're looking at to aerate the grass and then dropping seeds in to get the healthiest part of your lawn. And then what you do is you fertilize it. So you aerate it, you seed it, and then you fertilize it. Coming back a month, 2, 3 months, depending on how you are, you're fertilizing again, and that's with the PRP, the platelet-rich plasma, which creates more of the fertilizer, kind of the cascade of healing, where stem cells a little bit more of growth factors, and that's what you want to do. So to answer your question, it's hard. It depends on what's going on. If you truly need regenerative properties versus, hey, my tendon hurts, my shoulder hurts, we're able to maybe get away with the PRP. So multiple PRPs, I'm assuming that's the real question, multiple PRPs versus a stem cell because of a cost factor, it's hard, it's individualized. If your knee is in that stage, what I'm really pushing is we consider all your joints 4 stages of simplicity arthritis. So first of all, there's normal, young, healthy. Stage 1 is a little bit, stage 4 is almost total destruction. So we love people in stage 2, right? They're a little bit symptomatic, a little bit of an issue, but you're not being debilitated from it. If you're not being debilitated from it, but it's still nagging you, or it swells on you, or I played softball and I can't walk for a day or so, those are the perfect people. Those are the ones that are going to benefit the most when we talk about a prevention program. Stage 2, 3 is kind of where the sweet spot is. When you start getting to 3 and 4, now you're battling an uphill battle. If you're in stage 4, there's some doctors who are saying it's still worth trying it, but what do you have to lose? You kind of don't have anything to lose, because It's coming from your body. You're not rejecting it. It's not irreversible. Like surgery, once you have surgery, you can't reverse what happened. With the injections, it kind of will wear off. Either it's going to work or it's not going to work. For us, we put you in the best scenario where it is going to work. So ideally, we want to catch you in that second and third phase where we can get you maybe just with PRP. When you're getting outside of stage 2, 3, then you probably would benefit more for the stem cell and PRP. Stage 1 for sure, like we talked about tendinitis in your elbow, you talk about plantar fasciitis in your foot. You know, these kind of things really respond to the platelet-rich plasma, and I feel there's a major role. And I don't want you to think that this is just a one treatment, a one-time thing, and that's all you need to do. There's a whole coordinated program. So again, if you're choosing a doctor that says, "Oh, I'm just going to do a PRP," and you're going to go along your way, cash your credit on the way out, that's not who you want to go to. You want to go to someone who has protocols, who has an assessment, who wants to take a look at you and make sure he's not missing anything else. He wants to change your mechanics if they're off. All those things. I get back to the story with the tires on your car. If you have one tire that's a little bit lower pressure, you're going to still get to your space or the place that you're going, but you're creating an inefficiency in the tire. That's kind of what's going on in life if your mechanics are off. You're going to wear it out a little bit quicker. You're going to wear that right knee out if you're favoring the left knee. Your hip, goes all the way up and down from your hip, your knee, your ankle, into your spine. So the best thing, and I just said this morning to one of my good friends, it's like your body, will never catch up to how the body actually works. The body works 24/7. It's always doing something. It's always healing. It's always promoting blood circulation. Nothing works that way. All these computers, everything else, nothing works like the body. Nothing can replace it. So why not respect it? Because it's the best tool for self-healing, and let's put it into its proper mechanics so it can do that. When it does shift out of mechanics, what's the most organic way of treating it? It's some of the self-healing that we have in the body at higher concentrations. Look, surgery is great, when you need it. Medications are great, but really, I don't think that should be our first line. That's not our backup. We're being picked as a country that we just kind of fall back and we're lazy and we don't do things. It's kind of true if you really truly criticize us. Let's try to be more proactive. Let's respect the body a little bit more. Let's understand our metabolism. Let's understand what's going on under the hood. That's really what your goal is overall. So to tell you, between PRP and stem cell, I like it. It's self-healing. It's self-promoting. Is it as good as steroids? It's better than steroids because it's a self-healing, not a destructive way of dealing with it. Are steroids still play a role? Absolutely still plays a role. Some of the role is because, what insurance covers. Does insurance dictate? Does insurance hold us back to some of the cutting-edge medicine? They don't hold us back. They want it to be safe. We have the FDA that's out there that is out to protect the masses. Are there certain people doing this, the people that are considered cutting edge? Yes, absolutely. We have to be pushing the envelope. Otherwise we'd be still all excited about penicillin. We need to keep moving forward. We keep growing. The COVID vaccines, look at Johnson & Johnson just came out. I mean, these are all advances. Hopefully in 2 years we look back at this and kind of laugh at ourselves. But, we're all going to get through it. But I think there's a major learning curve that we're going to get out of it is to respect our body more. And that's really you have to go to the right doctor that has that philosophy. And, it's not about a pill. It's not about a surgery. It's about assessing what's going on, which we pride ourselves on at Michigan Sports and Spine. We take a look back. We take a look at your whole body and see what we can do to enhance, maybe just solve your problem, but also prevent the next issue from coming up, which is what we do. And we just talked to a gentleman here. He's got a weight loss, an unexplainable weight loss, and he's lost a lot of muscle in a short period of time. Well, he's got back pain. Okay, but this could lead to something else. So I asked more questions. I'm more concerned about how that's being treated overall, so we don't run into problems or we don't run into surprises down the road. And sometimes picking it up from an aggressive physician that wants to treat you as a whole is maybe the best prevention you could ever have. Guys that just hand out a pill, I would think twice about that. So again, time for success stories. Nicole loves this part. And it's always a hard part to struggle with because I'm fortunate. We have a lot of success stories here. We have them on a weekly basis. I have, people that are so skeptical and they come in and we're treating them and, they walk, I've used this before, they walk out all angry and they're miserable and they look, their hair is all messed up and they're just in terrible pain. And within 6 weeks, we got them back and doing their activities or at least enjoying life a little bit. And I don't mislead. Probably the other thing I don't like of my colleagues is like, we're going to fix you, we're going to make it all better. I try to be honest. I don't overplay it, I don't downplay it, I try to be as accurate as possible. Because with the internet, you can come check us out. Check out what I say. Check out, the type of treatment. Check out, anywhere. You can put us up at anybody in the country. That's what's so nice about the internet now, which is a problem for us because we are being challenged. And a lot of docs don't like to be challenged. For us, we enjoy it. I'd rather learn something new. We'd rather, I don't want to miss anything. So when we talk about injections, I have patients that say, well, I had injections, it didn't work. Therapy, it didn't work. Well, again, it's getting back to my simple comment that not everyone's created equal. Not a protocol. Like I just had a patient yesterday, had a whole laundry list of stuff that's been going on since 2018. But it's all like, little bits and pieces. She never had a coordinated time where everybody was on the same page and she got better. Fortunately, she doesn't have anything too serious. It's just nobody's ever driven her into this is what you need to do for this period of time. This is your 6-month program. It's like, oh, I had an injection here. I had this type of injection here. 5 months have passed. Then maybe I went to therapy for a couple weeks, and then I had to take this medication. And then I walked in with terrible pain, so they gave me this pain shot. But never was there a set protocol. For here, good or bad, we have a set protocol that works. It's worked very successfully when everybody's on the same page. So again, when you come in and say, or you're out there saying, I had injections, oh, I had therapy. It's who did the therapy? How did they handle it? What coordination did you do? Were you honest with yourself? Did you participate? Did you do the home exercises? Did you do the do's and don'ts? There's a whole checklist for you. The biggest thing you need to do is look in the mirror and say, did you really make the effort? And sometimes you're the limiting factor. Sometimes it's the education of the physician. Sometimes it's the disconnect between the physician and the therapist that they're not on the same page. So there's multiple things that we've experienced over the years that I feel that we are being proactive to be preventative so we are on the same page. I have patients that are like, well, I'm flying out of town. I work hard. I don't have time to do this. Well, then I'm not going to create a successful outcome for you, and I do respect that, and we work around it to the nth degree, but at the end of the day, if I can't get you to buy in to what the program is or you have time for it, we're not going to be successful. There is no magic wand. There isn't no, this is a thorn in my foot and I pull it out. Not my medicine. Other people, hand surgeons, stuff like that, they can do that and boom, it's gone. I get more complicated cases. One, because we're the specialists. Two, everybody tries everything else either on their own or with their primary care. By the time they get to us, I'm already dealing with an older injury. I just dealt with someone who's 5.5 months in. If you read the literature, which actually there's newer literature, if you go past 6 months, that's considered a chronic issue. Your percentage of getting healing back to normal is near 0%. In our practice, it's much higher. But if you just look at the statistics, what's being published out there, if your problem goes out 6 months, then your stats of getting 100% better is 0. For us, we take that as a challenge, and we try to say that you really didn't start treatment until you saw us. So we try to start the clock over. But again, we're fighting an uphill battle when that happens for us. So yeah, the example of our successes versus patients that come in and say, oh, I did it, I've done it. They're like, we just had someone that has the resources to go anywhere and has gone anywhere and has came into our program and has never been treated this successfully before, with the education, understanding what should and shouldn't be doing, following our protocols, following our treatment, and working with Faith as the therapist here. And we also inject them. So we had a combination, we had a game plan that works. Not all the game plans is the same for everybody. We customize as much as we can. But again, some of it may be overlap because we're dealing with spine. We're dealing with, there's only so many ways you can twist the spine up. but we have all the different tools to assess that. So the last question, my family doctor says I should find a spine doctor that is fellowship trained. Does your staff have this training? Is there a significant difference? So 100%. We're all fellowship trained. I've took further training. I've taken more specialty boards. Dr. Bonech has finished his fellowship training at the University of Michigan. You know, he's got high marks. He's the smart one in the office now. Dr. Kahn's here actually doing the fellowship. So we do a fellowship preceptorship here every year. I've done, I don't even know anymore, more than 15 fellows that I have trained that are out around the country with, the Michigan Sports and Spine model, or they've tweaked it, or they've advanced it, because that's what I encourage them. I encourage them to learn what you can from me, and then further your education so you become smarter, so I can come work with you later in life. But absolutely, you want to go to someone who, I'm not saying someone who's not fellowship trained isn't as good, but you have to take on someone who took the extra time to learn what's going on. Again, it's about going to the person with the right tools to treat, okay? Not all PM&R doctors do what I do. There's guys that do spinal cord injuries, that do neurogenic bladder, that do movement disorders. I took on this specialty for sports medicine, musculoskeletal pain management. This is where my sweet spot is. When I get somebody with a head injury, we do it for a little bit, but there's guys, and I have no problems referring to them, that they're better than me at. That's because I'm not here, there's no ego here. I want to get that patient to the best person. Because if I put you with the right person and I do the right thing, you're going to feel better about us and hopefully refer us other people when it falls into what we do. We know to stay within our lanes. And when they're out of the lanes, we know to recognize it and get you referred to the right person. And we don't really hesitate to do that. We do that quickly. And a lot of times with the way COVID is and social media and texting and emailing, I'm on the phone with the patient, texting the doctors that I think you need to get in with, and that's what I'll do. I'll go to bat. I'll say I need this person in. It just happened yesterday with one of my coaches. Having a great season, wants to put off surgery, but he needs to be seen by the surgeon. There's a 2-month waiting list. Well, I'll go ahead and text him. I need a favor. I need this person in. And it's without hesitation, because there's a passion of treatment here. We have a passion to treat you, to get you to the right place. And if you're hurting, I'm not the pain doctor who says I have a 2-month waiting list. That ego never happened here. We're very confident in what we do. And from day one, I said nobody waits more than 2 weeks. So we'll get you in, we'll work longer, we'll see, stay later to get people in to be treated who are motivated. The motivated part is huge. We're not here to just write your pain medications and fill out your paperwork. That doesn't excite me, and that's not what I'm looking for. I'm looking for people that are passionate about getting better, and we want to be the ones that help you get through that. So again, to summarize, it's always the primary pain general. You look at what's causing it. I've always said it. Okay, some things can have referred pain, or maybe you think it's your leg pain, or actually it's coming from your back. You've got to understand what the primary problem is. You got it, like with the bowel and bladder thing. What's the primary cause? Is it coming from internal, or is it coming external through your spine? Those are the things we look at. We've got to get to the root of the problem, obviously. Who's treating you is a huge, huge treatment. So just make sure you do your research. And that leads to our lovely quote of the day. Sometimes the problem is not the problem, nor is the solution always the solution. So again, that's a little confusing, but you've got to look. Like I said, a referred pain. If I'm having pain in my hand, I'm losing my grip. Okay, they look at your hand. This just actually happened with a family member. Well, the problem was coming from his neck, and everybody was treating his hand, including him. Was like, well, I don't really have issues with my neck. Come down to it, that's what's causing the primary problem. And the solution always isn't, well, inject the wrist, okay, where the problem's up in the hand. It took away the little secondary tendinitis, which I can get into, but we're running out of time. The secondary tendinitis in the hand, which is just a secondary problem, you never solve the primary problem. Always go to a doctor that has the confidence and the knowledge and the research and ideally the education behind it. At Michigan Sports and Spine, we have that. We pride ourselves on that, and we're here to kind of help you. I'm long-winded. It's a nice day. Get out and enjoy. Peace out. Love you.